refresher for some people. We have hopefully a good crowd of people who will be joining us this evening. I'm going to encourage you just a few rules as we sort of go through the presentation. If you could remain muted throughout the call, that would be great. Secondly, if you have questions, you can either put them in the chat and write them down in the group chat, or we can wait to the end and we'll answer all of the questions at that time. There will be a question and answer period towards the end of the presentation. Amanda's going to do the introduction of our speaker this evening, and then we'll get started.
Good afternoon, everyone. I have the privilege of introducing Martine Lopez, who is our presenter this afternoon. She's a mental health social worker and an assistant professor. She currently works as an outpatient clinical therapist at a family healthcare clinic in Peel Region. And she teaches mental health and behavioral sciences in the family medicine program at McMaster University. She's going to be talking to us this afternoon on effective communication. And as Len said, if you can just keep yourself muted, only her mic should be the only one unmuted, and then we'll take questions at the end of the presentation. So welcome, Martine, and thank you for taking the time out this afternoon to share some wisdom with us. Thank you.
Thank you for that lovely introduction. It's always strange hearing yourself being described, but appreciate it. And thank you for asking me to come. So I'm just going to screen share the presentation that I'm going to be sharing with you all this afternoon. So just bear with me here while I get that started. So don't really need to introduce myself after that introduction, but yes, I have been in the field of social work for quite some time now. I think I graduated a long time ago, over 15 years ago, and I've been working in various fields, but my area of specialty really is mental health. So as you can all imagine, in mental health, communication is really key to being able to offer and provide sort of effective care for many individuals who are experiencing mental health difficulties or difficulties, period, to be honest with you. My numbers in terms of how many patients I've been seeing has definitely increased as a result of the pandemic. A lot of individuals out there are just finding, you know, these times quite challenging, as I'm sure many of you all are. And so I'm hoping that the information that I share with you all this afternoon is helpful in terms of allowing you to be able to communicate, you know, what those difficulties are that you're experiencing with your friends, with your families, sort of with your loved ones. So just to give you a little bit of an outline as to what we're going to be talking about this afternoon, first I'm going to give a little bit of an introduction, and then I'm going to be talking about what is your communication style, right? Because I think it's really important that if we're trying to build our communication skills, that we are first able to really identify what is the style of communication that we are currently using. And so I'm going to talk a little bit about that. And then I want to share with you some skills that will hopefully help you to build more healthier or better communication with those around you. And some of those skills include active listening, setting boundaries, regulating your emotions. I'm going to teach a technique that I often share with my patients, which helps with that regulation of emotions, which is called the STOP technique. It's an acronym, but I'll get into that a little bit later. And then just some other tips that are not necessarily skill-based. And then I'm going to share with you some resources of support if you are, you know, continuing to have some difficulties, you know, just some resources of support that you can access. And then at the end, as Lennox shared, we're going to have hopefully some discussions, and hopefully you'll have some questions that I'll be able to answer. So, the stress of living through a pandemic really has influenced the way that we communicate sort of with each other. And I'm sure you've all kind of felt that things are so different now, even the way that we communicate with our loved ones around us. So, having tough conversations outside of COVID was hard, but in the middle of this pandemic, having these tough conversations can really feel draining sometimes, especially, with everything else that's going on, right? So because of the long-term stress we're experiencing, regulating our emotions can feel quite challenging at times. And, we might find ourselves snapping at others and wondering later, why did I react that way? Why did I react so strongly? Under stress, any conversation with disagreements or strong feelings can sometimes feel really overwhelming. But it's okay to feel worried about having hard conversations with loved ones. This is normal. And especially during a disaster, it's even more difficult, as I shared. So, in order to manage these difficulties more effectively, it's important that we become more aware of what our style of communication is. And once we've identified what that style is, we can then sort of implement changes in whatever those areas of concern are within the way that we communicate. So now I'm just going to talk a little bit more about the 4 styles of communication. So we all have a unique sort of communication style, a way in which we interact and we exchange information with others. And there's 4 basic ones. Now, it's important that we understand that each communication style, while we all use them, the assertive communication style has been found to be the most effective. So that's the one that we're really striving to use more so, right? And that's because it incorporates the best aspects of all of the different types of styles. So I'll just quickly share with you what those 4 basic styles are, as you can see from this diagram. So with the passive communication style, individuals who use this style, they often act sort of indifferently. They yield to others, they usually fail to express their feelings or needs because they're allowing others to express themselves, right? And frequently this passive sort of communicator lacks outward communication, which can often lead to some misunderstanding. Sometimes anger builds up. Sometimes there's a little bit of resentment. But at the same time, these passive types of communicators can be safer to speak with when a conflict arises, because they most likely will avoid a confrontation or defer to somebody else, right? So passive communicators often display a lack of eye contact or body posture. These are not all synonymous, but these are, generalized sort of things that passive communicators can display, right? And so as you can see from the chart here, sometimes they're emotionally dishonest, sometimes they're indirect with their communication. And as I mentioned before, others' rights and needs take precedence over their own. Now, the second type of communication style I want to just talk about is the aggressive communication style, and that's the one in red. So with the aggressive communicator, usually these types of this style of communication is not something that you're going to miss. It's quite apparent. You're either going to hear them or you're going to see them, right? And sometimes you might even feel them. So that aggressive communication style is emphasized by speaking loud and having sort of maybe a demanding voice, maintaining this sort of intense eye contact and sometimes dominating the conversations or controlling others by blaming, intimidating, criticizing, threatening. Now, these aggressive communicators often issue commands, and they might even ask questions rudely and fail to listen to others, right? So many times these individuals are, they're quite inappropriate, they can be quite direct, right? And that last on the bottom of that, it says, I boldly insist that my rights and needs prevail. This is usually how an aggressive communicator may come across. Okay. And now the next one is passive aggressive. This is a little bit of a combination of both the passive and the aggressive. So that passive aggressive communication style really, it appears passive on the surface, but within that, the individual may feel powerless or stuck, or there might be some building up of resentment that leads to seething or acting out. Most passive aggressive communicators will sort of, maybe mutter to themselves rather than confront a person on an issue. They also may have some difficulty acknowledging their anger or using facial expressions that don't sort of correlate with how they feel, right? Passive aggressive communicators are most likely to communicate with body language or lack of open communication with others. And you can see there that, sometimes they are quite emotionally dishonest, right? They're indirect in terms of the way that they say things. They might, that the quote on the bottom is, "I subtly make clear that my rights and needs prevail." So their communication is not necessarily direct. Now, the green one is the one that I hope we can all aspire to be, which is assertive communicators. So this, as I said at the beginning, this is thought to be the most effective form of communication, right? So this style features open communication, the person is not being overbearing in the way that they communicate. They can also really express their own needs, their desires, their feelings, while still considering the needs of others. So assertive communicators aim for both sides to win the situation, balancing one's rights with the rights of others. And so I want to talk a little bit more now that I've explained sort of, what these communication styles can sort of look like. It's important that we identify sort of what is our communication style. Now we might use multiple different styles, right? But we're trying to strive to be more assertive overall in the way that we communicate. So we might favor one over the other is basically what I'm saying, but being more self-aware can be impactful. And I want to share just a quick video with you about these communication styles and when it's appropriate for them to be used sort of in different settings. Okay, so, to that point, it's not what we say, it's how we say it. That's really, really important as well. Tone of voice, all of those things are really important in terms of the way that we communicate. So the reason why I wanted to share that with you is because I wanted to share that little video with you to show you that even though we're all trying to strive towards being these assertive communicators, there are times when we still sometimes need to use other communication styles depending on the situation that we're dealing with or the person that we're communicating with. So understanding how we communicate is important, but also how others communicate can really be key in helping to build, more healthier communication with each other. Now, in order for us to develop these assertive communication, this assertive communication style, I want to share some skills that can help with that. Okay. So the first one is active listening, right? Now, while it all may come naturally for many of us to actively listen to others, one of the important things that we can do to better support each other is to really think about how we listen. Now, active listening is listening to someone with the goal of understanding and caring about what their experience is instead of providing solutions, which many times we often do, right? So when someone's sharing with us a difficulty that they're going through, many times we have this natural urge to kind of give them some advice or give them tips to make things easier for them. But often people don't want solutions or tips in those moments. They might have problems that are bigger than being able to be solved in that moment with just that one conversation. And sometimes they just really want to be heard and understood versus somebody giving them a solution, right? And so there's 3 things, which you can see on this slide, that we can do to practice active listening with people. The first one is to just listen. So if you find yourself giving advice and trying to problem solve with an individual, just pause and really listen to what the other person has to say. Shift your mindset and listen with the goal of understanding. So seek to understand first what they're going through. The second tip is to ask open-ended questions, right? So to better understand the other person, we really want to ask these open-ended questions about what they're going through. So open-ended questions are those questions that need more than 1 or 2 word answers, right? So I'm not asking, do you like red or black? I'm asking, what's your favorite color? Right? You see the difference where asking an open-ended question allows for a lot more dialogue, right? Another example of that could be, instead of asking, are your kids doing their schoolwork? You could try, how are your kids doing? What's going on with them right now, right? And then the third tip that's there is getting clarification. So making sure that we understand what the person is sharing, right? So we can either summarize what they've shared with us or paraphrase what they've shared to gain a better understanding or gain that clarification. So it could be like, it sounds like you've been feeling really stressed out about virtual schooling and it's causing you some anxiety. Or you could maybe clarify a question like, it sounds like you're feeling anxious about work. Is that right? So sometimes the best thing is just to be there with the other person, right? Sit quietly, be in the moment with them. Being able to talk through a problem and to feel really understood can help someone feel better, even if there's no obvious or immediate solution to the problem. Okay, so that's active listening. Now, the next skill that I want to talk about is setting boundaries. Now, this is a really important one in communication, okay? So there are topics that many of us don't feel comfortable talking about, right? You might worry that someone may react strongly to what you want to share. Conversations about some issues can get really heated, so much so that others may not be willing to hear your thoughts. And it's important to know how to step away when a conversation becomes really, really uncomfortable. right? And if it's something really important, I'm not suggesting that you don't come back to this conversation. I'm just saying maybe in that moment, you're not able to really manage your emotions to be able to have an effective, kind of communication between you and the other person. So setting boundaries is a really good way to keep relationships intact. When you disagree with somebody or you disagree with someone's opinions or their actions. So to set a boundary, we want to be direct and focus on expressing how we feel. So we're going to be doing that through the use of I statements, right? So you could say, I don't feel comfortable talking about this, or let's talk about something else right now, or just no, I don't want to do that. Being direct keeps your boundaries firm and it helps others avoid going into, it helps the whole situation not to become more conflicted. So boundaries are important all the time, but even more so during COVID. Setting boundaries can help you protect your physical health during this pandemic, and it can also avoid heated discussions about hot button topics. And I think we all know what those are in COVID, right? Vaccine, that's what. And take care of your mental health on top of that, right? It's okay to set a boundary and to say no to things that make you feel unsafe. And when I talk about safety, I'm not just talking about physical safety. I'm also talking about your emotional safety, right? We'll talk about that in a little bit. Now, the next tip I want to talk about is our ability to regulate our emotions, okay? So when we're under stress, it's easy, really, really easy for us to react without thinking and respond quickly and emotionally to what others say or do. So that's called being reactive, right? It's easy to snap back at someone who doesn't share the same opinions or values as us. But this can also be quite hurtful and it can also damage a relationship. So I want us all to try and pay attention to what you are feeling and know when to pause before reacting. Now, I must admit, this is one that I often struggle with. And so I'm sure I'm not alone in that. But sometimes it's better to bite your tongue, right? So that you can prevent others from feeling hurt or to save a conversation, right? It's normal to have a hard time pausing to slow down an emotional reaction, but it's okay to react strongly to what others say or do when we're under a lot of stress. But when we pay attention to the way that we react, and we take responsibility if we say something harsh or hurtful, so owning our mistakes and apologize in the moment, that's also really important to effective communication. And it also helps to maintain that relationship with somebody, right? So when your emotions are threatening to get the best of you and you're tempted to take unhelpful actions, we're going to be using the next slide, which is it's a stop technique, which can help those of us. And it's thought of as emergency mindfulness. It's an emergency mindfulness skill, right? So it's when we're in those moments where we want to react, but we know if we react at this time, our reaction might be fueled by some negative emotions and there might not be a positive outcome to it. This is the skill that I want you to think about trying to use. It's a skill that I often teach my patients in my practice. It's an acronym for STOP, so it's pretty easy to remember. And I'm just going to share that with you, with this skill with you now.
STOP. CBT in a nutshell. Learn this one key skill and you can start to take control of your emotions and your life. So STOP is an acronym. Stop. Take a breath. Observe. Pull back. Practice and proceed. So as soon as you notice the intrusive or distressing thoughts, the emotion, your body reacting, whatever it is that you notice, say to yourself, stop. Just pause. Take a breath. One slow, deep breath. Already you have shifted your focus of attention away from whatever was distressing you. This helps you step back from your thoughts to defuse from them. Taking a slow, deep breath is going to reduce the physical symptoms of distress, those horrible things that we feel in our body, which seems to confirm that something bad really is happening, and this is awful. Your thinking brain is coming back online. You've shifted your focus of attention, you've calmed down that physical response, which allows the thinking part of your brain to start working again. Observe. What is my mind saying? What are the words that my mind is saying? What am I noticing in my body? What am I reacting to? Pull back, put in some perspective. What's the bigger picture? There's always a different way of looking at something. What would someone else say about this? Someone that's not so emotionally involved, someone that's calm and rational. What advice would I give a friend? Is this thought fact or opinion? And how important is this really right now? What's the helicopter view, that bigger picture, that pulling back? And this is the thinking differently of CBT. Practice what works or proceed. So this is where we can decide what's the best thing to do right now. What can I do that fits with my values? Where do I want to go in life? What's really important to me? And what is going to be effective, appropriate for this situation, and proportionate? And this is the doing differently of CBT. You can practice stop several times a day, every day. For example, you might run through the steps of stop over a cup of tea. Every time you have a cup of tea, go through those steps. Practice stop when you don't need to. And that is key. Like learning to play a musical instrument, you need to practice, practice, and practice. It will be helpful to carry written stop reminders with you, and you can download them from the website. You can download the Stop app from the app stores. And start to use stop for the small stuff, the small upsets. Because it's a big ask. Too much to do it for the big stuff straight away. You need to practice. And then you can start to use stop when you really need it. And after a while, with repeated use and practice, it will become a habit, and stop will be automatic. So download stop resources from www.stop.gg. You'll find other self-help resources at getselfhelp.co.uk. Stop is the first skill of the Decider, thedecider.org.uk. And you will find self-help MP3 downloads, many of which use stop, from www.getselfhelp.co.uk. selfhelpmp3.co.uk. Stop!
Okay, so she talked a lot about CBT, and some of you are probably thinking, well, what is that? What is CBT? So CBT is cognitive behavioral therapy, and it's basically an evidence-based approach to psychotherapy. So as a therapist myself, it's a form of therapy that we often use with our patients, but you don't necessarily have to have a mental health issue to use some of these skills. This is a great skill that can be used through, when you're having any type of difficulty in terms of communication or any type of difficulty with intense emotions. Okay, so she talked about using the Stop app. There's actually an app that you can download for free. And it'll give you sort of reminders about the different acronym and what that sort of stands for. So the STOP technique is a mindfulness-based practice. So it's encouraging you to really pay attention to what's happening in the moment, right? And it'll help you to diffuse stress in that moment as well, right? So creating a space in the day to pause, to slow down that racing mind and to get back into the present moment has been shown to be really helpful in reducing sort of the negative effects of stress. I saw a couple of you giggle when she said a cup of tea. Obviously, she's English, and so that's something that's synonymous with English culture. So yeah, but having a cup of tea is great. Just to help you to slow down. It really does encourage you to do that. Okay, so some further tips that I wanted to share with you just about effective sort of communication. So the first one is explaining the what and the why, right? And this really is referring to being open and transparent with our communication. So most people's concerns come from an unfamiliar situation or experience, right? And so to sort of help minimize concerns, we really want to let those around you know what you're thinking, right? What are your intentions and why might you be acting in a certain way that's maybe not something that you're used to doing, right? So, if you're usually a very calm, cool, collected person, and today you're very agitated and you're maybe a little bit more reactive and snappy with others, it's important that you explain to others around you maybe why you're in the mood that you're in, maybe why you're acting in this way, right? Living in a world of chronic uncertainty can be really jarring, right? Right now, there's so much uncertainty around us and it can be really anxiety provoking, right? But knowing what to expect can help those around you to really offer them some reassurance and allow them to be more understanding towards you, right? So if I'm having a really bad day at work, it's important that I let my kids know, look, mommy's just not having a very good day right now, so that they know that if I'm a little bit snappy, it's not necessarily because of them, right? Or the way that they're behaving, right? The next one is about being clear, calm, and consistent. So I'm sure you've already had to make some really difficult decisions recently, maybe about work, maybe about finances, maybe about the types of social interactions that you're having. Maybe there's been some difficult decisions you've had to make in your personal life and your family life. It's important that we communicate those difficulties with those around us so that they can understand, how we've been affected by this. And maybe they can possibly offer some guidance or further support. Be honest and transparent in your regular communication shows those around you that you value them as well. You value their involvement. Without regular transparency, in communication, misinformation and assumptions will develop, right? So if we're not transparent about why we're behaving in a certain way, then those around us might assume something that might not be correct, and they might be misguided. So being clear is very, very important. Now, I want you all to remember that communication goes two ways, right? So it's important that we take the time to allow those in our lives the opportunity to also communicate their thoughts and emotions, right? It's not all about us. So trying to create a safe emotional space for friends and family. And I talked about emotional safety a little bit earlier, to be able to share. So having this emotionally safe space looks like a space where there's an opportunity for those to share with no judgment, right? And these conversations can often lead to really more deeper and more meaningful connections with others. The next point is about going easy on yourself. You know, there's no COVID-19 communication handbook, right? You won't always know what you're doing. Some of the things you try will be great, and some maybe won't. And that's okay. This is really uncharted territory for all of us. So don't beat yourself up if something doesn't work. Try something else. And be sure to take your own messages to heart. So follow your own healthy eating and exercise tips and treat yourself with self-compassion and empathy. The next tip is about encouraging humor. You know, humor is great therapy. It can be fun, and it can also increase personal connections. So these are serious times, but we won't get through them if we all dwell on the negative. So find a lighter side of the situation by bringing humor and fun to your communications. And above all, show empathy and compassion, as I mentioned earlier, and understanding. Let empathy be your guide. Remember that we are all living in unprecedented times, and we may be juggling multiple responsibilities and stressors. So responding to others with a willingness to understand and to react with gentleness to oneself and to others and our environment is really important. So when we're compassionate, we are willing to put ourselves in the other person's shoes, and we relate to the other person's suffering and kindness with concern. If we remember that all individuals are only trying to be happy, I'm going to repeat that. All individuals are just trying to be happy. We'll find it a lot more easier to develop a sense of appreciation for the people around us, including those that may upset us or may hurt us. Now, here's just another slide of a couple other tips. Some I've mentioned before. Obviously, one of the first skills I talked about was active listening. So listening skills is key within. But I also never talked about body language and the importance of body language. 90% of communication is body language. And so, you know, within my own private practice, I must admit it's been challenging because all of my patients I've been hearing through the telephone. So I'm not able to really see them or pick up on certain body language, right? But when we're communicating with our loved ones, those around us, be aware, if you're face to face, obviously, be aware of what your body is saying, right? If you're not maintaining eye contact, does that show that I'm actively listening? You know, show interest through nodding your head, right? If I sit back and I put my, cross my arms like this, does that show that I'm open to what is being shared with me right now? Most likely not. So being aware of our body language is important. Also being confident, right? So that coming back to that assertive communication, taking ownership, using I statements, right? When you're confident, it's easier for other people to trust you and to rely on you, right? Being clear and concise, I spoke about this earlier. Positive and patient, very, very important. And just being respectful, right? Being respectful of others, of not only their space, but also in the way that we approach them using, you know, gentle tones of voices. And giving feedback, right? It shows that you're a good listener, right? So I talked about paraphrasing, right? Clarification, finding that out. Now, this next slide is really related more so to those of us who have little ones or maybe youth. You know, it's been a really difficult time for for our young people and also for children within the pandemic, right? And so, you know, I think it's important within all of this that we recognize that silver lining, right? So trying to turn this pandemic into an opportunity for us to grow closer as families or friends, building emotional resilience and strengthening communication with each other, right? And here's some suggestions that hopefully will help with that. So, you know, in relation to kids, and I don't know how many of you have children or youth in your home, but offering them reassurance, I think, is really important, right? To help them to cope with this stress, because, you know, their worlds have been turned upside down just like ours have. And making opportunities for them to still be able to have, you know, engage in normal activities like play and relaxation. So keeping regular routines and schedules as much as possible is really important for these individuals. Also being honest, right? So explaining the facts in a way that's easy for them to understand, and providing loving guidance and support in a way that really encourages children and doesn't hurt their self-esteem, right? The next one is about preventing stigma. So there's a lot of stigma related to COVID-19, unfortunately. And so by using facts and reminding children to be considerate of each other, I think is also important for us to try and break down that stigma, explaining that the coronavirus has nothing to do with the way that somebody looks or what language that they speak, right? I think that's really important to have those conversations with our youth and children, because there's a lot of misconceptions about it. And then lastly, and most importantly, is taking care of ourselves. So children will pick up on your own responses to the news, right? And so it helps them to know you are calm and in control when, you know, if you're feeling anxious or upset, you take that time for yourself and you reach out to your family, your friends, trusted people in your community, your church sisters and brothers. And so the next slide is about how do we do that in terms of self-care, the importance of us looking after ourselves. So this is a little, again, an acronym. We like acronyms as therapists because it helps our patients and those around us to remember these little techniques and tips. So this one is NESTS. And so it's 5 pillars of self-care. And so the first one is nutrition. I'm sure we all know how important it is to eat in a healthy way. I say to my patients and my loved ones, you know, what we feed our minds is the output that we're going to get. So if we're eating junk food, what do you think the output is going to be, right? So, you know, maintaining our nutrition is important, as well as exercise. And I know that that's difficult right now for many people because gyms are closed and it's a bit cold outside and we don't really want to go out. But even going outside for a 15-minute walk just to get some fresh air, you know, trying to keep active in the house. You know, if you have stairs in your house, go up and down them a couple of times, right? Sleep. Cannot stress the importance enough of sleep. For those who've had children as mothers, we are all familiar, and fathers, we're all familiar with sleep deprivation in terms of having a newborn baby. And what that does to us. But even for some of us who've not had children and we have a rough night's sleep, how do we feel the next day? We're usually a bit more irritable, usually not as happy as normal. You know, we're not feeling good. Sleep is so important for us in terms of being well. Taking time for ourselves as well. So engaging in what I like to call your joy practice. So what brings you joy? What are the things that you do that make you feel good, that's meaningful to you, that you value, right? So engaging those activities, pampering yourself, spending time in nature. And then the S is support. So it's really important that we all have some support around us, right? Whether that be emotional support, practical supports, you know, having a social network, whatever that may be. It's important that we all engage in supports, okay? And, you know, if we're still struggling, it's important that we, you know, we're able to ask for help. You know, don't be afraid to ask for help. You know, healthy communication can be especially tough during these times, right? And there is help out there for us. So, you know, practicing all of these skills that I talked about can be helpful to you and your family, giving them the opportunity, hopefully, to build more healthier relationships, even during stressful times like these. But if, you know, you're still struggling, here's some help resources that might be of assistance to you. Your first stop really should be your family doctor. Family doctors have a wealth of information. Many family doctors now have teams. I'm a part of one of those, a family healthcare team in Peel Region. And so, you know, with that comes multidisciplinary supports. So whether that be supports through with your mental health, whether that be supports from, you know, different areas of concern that you might have related to your health. So family doctors have a lot of information available to them, and they can direct you as to where you need to go. Now, if you don't have a family doctor, you can always call 311. A lot of people are not familiar with that resource, but 311 is toll-free number, just like 911, and it's basically for non-emergency information to be provided to you. So if you're not sure what supports are available in your community, or wanting to maybe speak to somebody to get some counseling resources or help with anything, call 311. They're very, very helpful. Okay, so that's it for my part of the presentation. This is just some discussion topics that I thought I would throw out there, but I'm not too sure if anybody has been asking questions in the chats. I'll just hand it back over to Lennox now.